When are doctors going to cure cancer? If several of your relatives have had cancer, you may face an increased risk of getting the same cancer. As a person who have this problem in my family, I like to share my finding with you. 2 of my aunts passed away by the breast cancer and my mom has suffered stage 3 of it. Nowadays, I think some of our friends, relatives and neighbors are struggling with the cancer. The pencil beam therapy not only is an innovative technology of proton therapy, but also has fewer side effects than traditional radiation. According to the MD Anderson ProtonTherapy.com, MD Anderson is a leader of proton therapy. It is a part of the MD Anderson Cancer Center, which is the top cancer hospital since 1990 by U.S. New World Report. Although my words are a drop in the ocean, but I hope to give you some information about an innovation to cancer treatment. Let's start with the proton therapy device. It has 30 foot tall, 110 ton weight, 360-degree rotation. The proton beam therapy delivers targeted radiation directly to the tumor. The process begins as the protons are extracted from the hydrogen gas through accelerated rotation around the magnetized field. The proton increases energy and speed. It can travel third speed of the light. The magnetic field stream the proton to the patient's room, which is called gantry. The gantry can revolve 360 degree around the patient who is laying on the robotic table and receive the beam in the different angle. The proton beam therapy use the custom-made devices which called aperture and compensator, which molded at the exact size and depth of the tumor. This therapy uses an ultra-fine proton beam with pencil point precision across the layer of the tumor. As the proton enter to the patient's body, they deliver powerful treatment to the tumor with no extra dose. It is the ideal technology for the irregular shape and size and deep tumors near to the sensitive area. Let's see the advantage of proton therapy. Lower risk of secondary cancer later in the life, especially for the children. Painless and little recovery time. Maintain in the current quality of life during and after treatment. Increased tolerance for chemotherapy. But the main point is this therapy couldn't use for all of the cancer. It can use for some of the cancer, such as the brain cancer, breast cancer, head and neck cancer, liver cancer, and something other cancer which mentioned in this slide. Duration of each session is 15 until 40 minutes, and each beam delivers 1 to 3 minutes. Complete courses of treatment may be from 1 to 30 sessions or 1 day up to 9 weeks. In conclusion, I mentioned that the pencil beam therapy is an innovation for proton therapy which has fewer side effects than traditional radiation, and I want you to think about that, how this treatment can give hope to the thousands of patients and families. According to the Dr. Michael Gillen, doctors are paving the way for better cancer treatment for more patients around the world. Thank you for your attention.